pada petang ini, mari kita sama saksikan video pelancaran sempena Minggu Kesedaran Penyelidikan yang diorganiskan oleh CRC Hospital Shah Alam. Itulah video pelancaran daripada CRC sempena Minggu Kesedaran Penyelidikan. Sepanjang minggu ini kita akan menyaksikan CME Research Topic secara bersiri, dan pada petang yang bahagia ini iaitu CME yang kelima. CME yang kelima bertajuk The Conduct of Research. Our speaker is Dr. Asyraf Syahmi Mohd Noor. Dr. Asyraf ialah Head of Research Registry and Data Coordination, Unit Center of Ethics and Research Surveillance, National Institute of Health ataupun NIH lah. Tanpa melengahkan masa lagi, saya ingin menjemput Dr. Asyraf untuk menyampaikan ceramah beliau. Mari kita sama-sama menyambut Dr. Asyraf. Hai Dr. Asyraf. Assalamualaikum.
Waalaikumsalam. Boleh dengar saya ke?
Kurang dengar sangat. Kurang volume kuat.
Adjust sekejap. Sekarang ni okey ke?
Okey sikit. Dr. Asyraf boleh present lah. Saya akan stop presenting.
Boleh nampak ke saya punya screen, slide?
Belum nampak lagi. Dah nampak dah.
Alright. Jadi boleh saya mula dah?
Boleh Dr. Asyraf.
Alright, terima kasih kepada Mr. MC. First and foremost, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh dan selamat tengah hari. Terima kasih saya ucapkan kepada Hospital Shah Alam jasa jemputan untuk saya memberikan berkongsi serba sedikit bersama dengan penyelidik, dan saya difahamkan yang menyertai Research Awareness Week ni adalah daripada seluruh Selangor kalau tak salah saya kan, dan juga all the MOH facility. So this would be a great opportunity for me to introduce and to share the knowledge with regard to the conduct of research. Kan, nama kita punya minggu ni pun Research Awareness Week. Jadi in order for you to perform or to conduct your research, you must first need to know lah what are exactly the requirement, apa yang sepatutnya dibuat sebagai seorang investigator dan sebagainya. Jadi for this entire 1 hour, I will try my best to share with you as much as possible, and probably towards the end of our session, I will open the floor for any question. So I hope that with this presentation, at least I can shed some light for those who meraba-raba dalam kegelapan kan. So jadi saya akan menerangkan berkaitan dua perkara. So yang pertama ialah the first one will be the overview of the research conduct. Okay, so saya akan menerangkan secara serba ringkas what exactly is the conduct of research when we want to conduct ataupun we want to perform a research involving Ministry of Health Facilities and Institution. So maknanya this requirement and the things that I'm going to share is going to be applicable at anywhere in the Ministry of Health. Tak kisahlah you pergi ke hospital ke KK ke bahagian ke JKN ke HQ ke. So all the requirement should be performed ataupun should be fulfilled by an investigator when you want to conduct research in Ministry of Health. And the second one I will share with you is the requirement, okay, that investigator need to perform. Okay, along the conduct of research, during the entire conduct of research, what should you do as investigator during your data collection, during your subject recruitment, okay, during the complete of the study, what you should do, dan sebagainya. Alright? So the first one, we will go to the overview of the research conduct involving Ministry of Health. Okay, so basically as introduction, as we know, most of our work will involve dealing with human, dealing with disease, dealing with prevention dan sebagainya. So jadi the uniqueness of the research, especially the medical research and health research, is because we do have the human subject as the key population ataupun as the things that we investigate. Okay, and whatever we do during our practice basically come from research. So in medical or in medicine, selalunya kita akan very familiar with the word evidence-based medicine, okay, whereby all whatever things that we do, for example, the drugs that we use, prevention, okay, the type of procedure dan sebagainya is from the research, okay, that is done by the researcher. So the primary purpose of the medical research basically is for us to understand, okay, the cause, the development and the effect of a disease, as well to improve the preventive diagnostic and the intervention lah. Okay, as I said, even the best proven intervention, okay, is continually evaluated, is continually researched, okay, to establish the safety, okay, the correct procedure and methods, the efficacy, the efficiency, accessibility and the quality. So when we talk about conduct of research, basically conduct of research means, okay, the practice of performing the systematic investigation with integrity. So bila mana kita kata sebagai berintegrity, so it is following the application of good research practice, cara-cara menjalankan penyelidikan dengan betul, and also the awareness of the norms lah, what is the do and don'ts that you as investigator should follow. Okay, so basically when we talk about conduct of research, the responsibility, okay, falls onto kita panggil principal investigator ataupun ketua penyelidikan. Okay, not that doesn't mean that the other is not responsible. Okay, but principal investigator are the one who should, okay, who is the most accountable person in the study team. whereby he or she need to ensure that the research is planned and conducted according to the applicable guideline and regulation lah, at any stage of the research. Okay, so I just would like to share with you, okay, some insight ataupun some thoughts so that we can just, you know, work on our mind kan. Kita petang ni dah makan semua kan, so jadi mungkin your mind tu is not bit slow. So just let you to think a bit, okay, about this two situation whereby, in your opinion, is it a good research practice? Okay, so the first one is a study involves a collection of data, okay, retrospectively, whereby you will collect the data from a patient registry, and it is conducted without a research registration. Do you think it's a good practice? Saya nak, mungkin ramai sangat kan, tapi kalau siapa nak jawab, the first most important thing for you to understand when you want to conduct a research is you need to register your research. Tak kisahlah you dapat study melibatkan apa sekalipun, but research registration, okay, is compulsory, okay, when it comes to research involving human subject. Okay, so these are based on the guideline yang kita refer, okay, in international level, even in local, okay, the Declaration of Helsinki lah, di mana it is a guideline on the conduct of research involving human subject. Tak kisahlah biomedical ke, health ke, public health ke dan sebagainya. So basically, this situation is not a good research practice whereby you conduct the research, the registration before you even start your data collection. Okay, so other than registration, what else is needed to be done by the PI? I'm so sorry if my voice sounds a bit nasal because saya sekarang terasa semu sikit. But then, okay, let's go back to our situation. So other than registration, what else is needed by investigator? So mungkin a few of you akan kata ethical approval. Okay, mungkin akan kata tak perlu ethical approval sebab dia tak melibatkan human pun. Okay, so I shall answer that question, okay, during my presentation. Alright, so we go to the second situation whereby the data has been collected, okay, the data that you have collected is placed in a folder in a public access computer right after PI is done with the analysis and reporting. So do you think this is a good research practice? Okay, so the answer is definitely it is not. Why? Because the data that we collect, that is considered private and confidential. Okay, and even without any identifier, by right, ethically or a good research practice, you should have a proper method of storage, archiving, and destroy of your research data. All right, so as I said already, so what should be done by the PI to the data? So basically, you need to, okay, store the data in a protected, for example, in a protected password in a folder, okay, and after certain years, probably, okay, you can either destroy ataupun, right now, we are moving towards what we call an open science movement, whereby the data that you have collected, we encourage you to deposit that data in a repository so that you can share the data with other investigators and you can make your data more impactful. All right? Okay, so basically when we talk about research, okay, there are few steps that you will do, right? So kita ada what we so-called research cycle, whereby our research will start from the hypothesis, for example, you get the funding, okay, you have the hypothesis, you have an idea, and then you start to design your protocol. You come up with your protocol, documents, and everything. So when you submit that, and then you shall go to the data collection stage, and so on and so forth. So if you see, basically, a good research is research that at the end of your research cycle, your data, okay, your finding can be reused so that the cycle is keep circling lah, basically. Okay, so when we talk about the research conduct, so basically each of the stages of the research cycle have its own requirement and good practices lah, whereby investigator need to be aware and familiar. All right. Okay. So this is what I will explain to you during my presentation. So basically, the conduct of research involving Ministry of Health, we do have sets of guidelines, okay, and requirement which are aligned and also which are taken from the international scientific guidelines, and we adapt it so that it matches with our local setting, whereby it is a specific standard set forth by the ministry, okay, through a series of guidelines and its policy. So basically, to assist researcher with meeting the requirement, okay, for you to fulfill the requirement, the ministry also has established a platform or a system, okay, to be used. Okay, for example, you register your research, you submit your research with an MRR system. Okay, so I will introduce you to a few systems that is there in the ministry, whereby you can use it to complete your research cycle. Okay, so we go to the, that is the overview lah secara ringkas, okay, on our research conduct. So we go into the detail, okay, on the investigators' requirement on the conduct of research when you want to perform your research involving Ministry of Health facilities and institution. So basically in the ministry, so we do have a circular, okay, whereby it was released back in 2022, okay, the Director General of Health Malaysia, circular number 4 atau bilangan 4, okay, 2022, with regard to the conduct of research in the Ministry of Health. So basically this circular has laid out 4 core aspect of the research conduct, or 4 requirements that need to be fulfilled ataupun on the process of conducting research involving Ministry of Health. Okay, so the 4 core aspect is involving, the first one is the research registration, the second one is the scientific review and ethical approval, the third one is the processing of application and also the grant, okay, whereby MOH do have our own grant, okay, and all of you who are Ministry of Health personnel can apply the grant, okay, for your research. All right, and the fourth one is the scientific dissemination. Okay, so from that circular, okay, NIH has come up with a guideline, okay, whereby it was released back in 2022 as well, together with the circular. So from the 4, we expand it more into 7 guideline policies. So these are the policy of conducting research in Ministry of Health, whereby as an investigator, you need to understand and remember, okay, the policies yang ada di kementerian untuk menjalankan penyelidikan. Okay, so we shall go to the policy one by one. Okay, so these are the policy regarding the general policy, the category of investigator, okay, the conduct of research, okay, from start to the end. And then we also have the role and responsibility of different entity involved in the research conduct. Okay, and we also have the policies on the ethical review, the policies on the MOH research grant approval, and the policy of the research dissemination ataupun publication and presentation approval. So basically, the general policy involving research conduct in the ministry, so all research conducted in facilities and our institution must comply with whatever guideline, okay, regulation applicable, whether it is internationally or locally. For example, we have Declaration of Helsinki. Okay, it is a guideline involving the research on human subject. And then we have International Ethical Guidelines for Biomedical Research involving human subject, ataupun SIOM. And we have the ICH guideline for the good clinical practice. So in locally in Malaysia, we have the Malaysian Good Clinical Practice and other requirements lah and guideline yang released from time to time. So the second policy in research conduct in MOH basically is the most important policy for you to remember and understand. Okay, whereby the policy states that all research related to MOH. So when we say research related to MOH, what does it mean? So we have 4 criteria. So the first one is research undertaken by the MOH personnel. The second one is research conducted in MOH institution and facility. The third one is research that is planned to use MOH data, patient or sample or personnel as a subject. And the fourth one is research that is going to be funded by MOH, research grant, MRG kita panggil. Okay, so these four criteria, if you have either one of these, would require an investigator to do two things. So the first one is the registration and the second one is the approval. Okay, so please bear in mind, please take note that the registration and approval is two different things. Okay, whereby registration is you need to register in the system, and the approval, it will refers to a series ataupun there are a few approval that you need to obtain. Okay, so as you can see in the slides, so the first approval is the approval to conduct research. Okay, and then the second approval is the recommendation of the scientific merit. Okay, when you have the submission of for grant, so you need to pass the scientific merit by the JPP NIH, for example. Okay, and then the next approval is the ethical approval, okay, whenever required. So we will refer that to the policy number 5. And then for the grant approval, there are specific ataupun SOPs lah in place whereby you need to follow that as well. And the last is the approval for research dissemination, we refer to policy number 7. So please remember, for all research related to MOH, you need to do two things. First, register. Second, to get the approval. All right. Then we go to the policy number 3. So policy number 3 is related to the conduct of research. So what are the requirements that you need to fulfill or you need to obtain when you are conducting a research, okay, in Ministry of Health? So in the guidelines, we separate the conduct of research into 3 phases. Okay, the first one is prior approval by the MOH. The second one is after the ethical approval, and then the third one is during your research conduct. So basically, prior approval by the MOH, the requirement is first for you to register your study in NMRR. That's the first one. The second one, we refer to the first approval that you need to obtain. Okay, so basically, principal investigator at site, and at least one sub-investigator from the site without PI or PI at site must obtain the approval to conduct research from your superior, okay, by using a form we call IA form, Investigator Agreement Head of Department Institutional Agreement form. Okay, and also during this period or during this phase, okay, investigator is advised to engage with the relevant stakeholders prior to selecting of the research site. So basically, why we include such clause inside the new guideline is because last time, okay, so most of the investigator, okay, that are applying for ethical approval, for example, you tend to just list out all the site that you want to go, okay, without ever even engage ataupun get to know whether in such site ada ke tak data yang you nak, and also is there any other additional requirement that you need to fulfill. Okay, so when this happen, so bila you dah apply for your submission for your ethical approval, and then suddenly you just go and find out that that site tak ada data yang you nak, for example, ataupun you cannot go because certain facilities do limit numbers of investigators to be in any department at one particular time. So that's why it is always very important for you to go and engage with your stakeholders, with your site. For example, kalau you nak buat site dekat Shah Alam, you have CRC where you can go and seek advice from them. Okay, and it will really help in terms of your timeline of your research sebenarnya. Okay, and the last one, the fourth one is related to the collaborative research, whereby any collaborative research with external organization outside of MOH will require some sort of agreement. Okay, sama ada research agreement, MOU or MOA. Then we go to the next phase, which is after obtaining the ethical approval and before the recruitment of the subject. So basically, a site without the IA form would require investigator to obtain the approval to conduct research at that site via site approval form. So these are the second approval that you need to obtain. Okay, and investigator also is required to fulfill any other site requirement depending on the respective facilities and institution. Like what I said previously, some institutions do have certain measures in place. Okay, for example, the limitation of the investigator ataupun the requirement for investigator from that site to be in your study team and so on and so forth. So that's why it's very important for you to engage with your site. Okay, the third phases is during the research conduct. So for example, you apply for an MRR, you have gotten your ethical approval, what you should do during the conduct of research, during the collection of, during the data collection, during the recruitment. So the first one is the subsequent or any changes pertaining to your research. Tak kisahlah melibatkan dokumen, melibatkan methodology, melibatkan addition of site, melibatkan addition of investigator, anything related to your research that have received prior ethical approval by MRC and you want to add something or change something, it needs to be submitted, reviewed and approved by MRC before it can be incorporated. Okay, that's the first thing. Please remember what that is called, that is referred to as amendment. Okay. Second one is the renewal of ethical approval. So basically, when you receive your ethical approval is valid for only 1 year. So let's say your data collection or your study will be about what, 3 years, 2 years, more than 1 year. So basically, please remember you need to renew your ethical approval before the expiry date of your ethical approval. Okay, selalunya dalam your ethical letter, usually they will state, okay, this ethical approval will be valid until what date and what date. So basically, before the day, you need to reapply for renewal. Bukan reapply baru, tapi just renew your ethical approval, which also is done everything inside the system. Suddenly you want to terminate your study due to whatever reason, it needs to be notified to MRC. Okay, and investigator also is required to submit the end of project or final report upon your research completion. Okay, so please remember these 4 things that you need to do, okay, during your research conduct: the amendment, renewal, closure, and also submit your end of project or final report. Okay. The policy number 4 is related to the role and responsibility of different entity involved in the research conduct. For example, we have director, okay, of the facilities or institution, we have head of department, we have CRC unit. So each of the entity have their own role, okay, that to make sure, for example, CRC you need to monitor, okay, director need to monitor that research that happened on your place dan sebagainya. Okay, we do also have what is so-called jawatan kuasa penyelidikan or research review committee, whereby, for example, we have JPP and NIH that we review the scientific merit of research applying for grant. Okay, and also we do have others, like last time we have JPP CRC, but right now we have abolished that and just left with JPP and NIH. Okay. Number 4, I would say the second most important policy after number 2, okay, which is the policy related to the ethical review and approval. So when ethical approval is required, okay, is when the research will involve ataupun will include human subject, okay, whereby research involving human subject requires ethical review and approval by the Medical Research and Ethics Committee, MOH. So in research, human subject can be defined as 2 things, okay, 2 criteria. But the first one, if you have the interaction with your subject, for example, you go and you give the intervention, or you approach the subject to give a questionnaire, or you want to interview the subject. So any type of intervention, so interaction, so that is considered to be a human subject in research. So the second one is investigator has the access to the identifiable private information, whereby you, even though you don't really meet this, you don't really see the subject, but if you have the access to the medical record, if you have the access to the patient registry, if you have the access to the clinic record, so that is considered also a human subject. And if your study have such criteria or such things, then it is a requirement for you to have the ethical approval by the MRC before the data collection. Okay, please remember that. All right. And then number 6, okay, is related to the MRG ataupun MOH research grant approval, whereby we have the MRG review panel, which is chaired by our Deputy DG, which also currently the one who come from Mr. Shalam, Dato' Dr. Nufariza. Okay, so the review panel, okay, will convince and give the final approval to the research requesting for the fund that have been supported by DPP NIH and also has obtained the MRC approval. Okay, and the last policy in the guideline is related to the publication and presentation approval. So all dissemination of scientific output such as abstract, oral or poster presentation, research report, journal article and conference proceeding, either undertaken by MOH personnel or utilizing data of MOH patient sample or personnel as a study subject, or research that has been funded by the MOH grant shall requires review and approval by the DG prior ataupun before the publication and presentation. So that are the 7 guidelines related to the policy of research conduct. So basically, in summary, from start till the end, okay, is like the one show on display on the screen. So the first is registration is mandatory for all research related to MOH, and then investigator need to get the approval, okay, to conduct the research from your superior, okay, from the HOD, from the directors, and then if there is any sort of collaboration with the external parties outside of MOH, you need to have an agreement, okay, and for research involve human subject, you need to have the ethical approval from MRC, and then related to MRG, the one that applying for MRG, once you have received the ethical approval, the submission will be reviewed and approved by the MRG review panel. And then once you want to start the data collection for a site that doesn't have the HOD-IA form, you will need to submit the site approval form. And then investigator need to comply with the post-registration atau post-approval research activity, such as amendment, renewal, closure or termination notification, and to update the research activities. And last but not least is publication and presentation approval by the DG. You need to obtain that before any research dissemination or research publication. Okay. So when we look back at the research cycle, so basically it's already representing the 70%. Okay. The 5/7 of the entire research cycle, which actually is being catered by the NMR system. So that's why NMR system is a very important system when you want to conduct research involving Ministry of Health. Okay. So in terms of the flow chart, so this is the flow chart of the research conduct, or basically the NMR system, whereby we have a few types of submission, and everything should start from the research registration, okay, with several documents required to be submitted. And then if your research, for example, doesn't have the requirement for ethical review, once you have registered, you have obtained the NMR ID, you can start your research. Okay. And for research that is required to have the ethical approval, so basically, once your study has registered, then it will be forwarded to MRC for the ethical review and approval. With the ethical approval, then only you can start your research. Okay, for research involving MRG application, once you have received your ethical approval, only then it will be reviewed by MRG panel, okay, review panel, and once you receive your grant, then you can start your study subject. So during your research conduct, research activity, anything related to any updates, reporting or notification should be made to MRC and also to the grant committee. All right. And once you have finished with everything, and then you have finished with analysis, you have to come up with the final report. Before you can disseminate your finding, you need to have your DG approval. So these are the flowchart of the research conduct in MO. To the requirement of research registration in NMRR. So what you should submit, okay, during your research registration. So basically, only 4 things is required, okay, to be submitted by the study team. So the first one is the investigator CV. So So your CV need to be uploaded into the system, and all of the study team should have their CV uploaded into NMRR. Okay. The second one is the approval to conduct research form ataupun the HDIA form. Okay. So that form should be uploaded into the system during the submission of the research registration. And then number 3, okay, GCP certificate, Good Clinical Practice Certificate. So this one is a certificate you obtain once you pass the exit exam in Malaysian GCP course. Okay, so basically for those who still doesn't have the GCP cert, please go and apply for the course. Okay, it is conducted, I think, even in CRC Shah Alam. Okay, and along over the years, there are, I think, multiple series of the course organized, and with the GCP, it involves interventional study, because the requirement by the Malaysian GCP, okay, ataupun by NCCR, National Clinical Research Committee, is all investigators should have GCP, okay, especially when you involve in research involving human subject, okay, such as interventional study ataupun clinical trial. So for other type of research, for example, observational study, okay, mixed method study, qualitative study, the requirement is, at the moment, it is not mandatory, okay, for everyone to have, but at least a few of the investigators should have the GCP during the submission. And we always highlight that PI, as the head of the study team, that is the requirement for you to obtain the GCP before you can start to conduct the research. One good thing about Malaysian GCP compared to other countries is our GCP is valid for life. Okay, compared to the European GCP, for example, so it is valid for 2 to 3 years only. So
sorry Dr. Asyraf, Dr. termute.
okay.
Okay, thank you Dr.
All right, no problem. Sorry for the technical things. So the last requirement for NMRR registration requirement is your research information. So basically, you need to have your description, your objective, your study team list, your study site, your sponsor information, dan sebagainya. So this one, I would always advise investigator, you need to have a complete protocol, because complete protocol will definitely be very helpful during the research submission. Okay, you no need to submit the actual research protocol during the registration, as you only can just copy ataupun type again whatever information that is present in the protocol into the submission. Okay, so basically for registration of NMRR, for registration of research, only 4 things is required. I repeat again: CV, GCP, the IHDIA form, and your research information. So basically, the protocol, the PIS, the ICF, all other document is not required for registration. It is only required if you have the requirement to ethical review and approval from the MRC MOH. Okay. So a bit on IHDIA form. So as I said, basically it is a form that need to be uploaded or submitted during the research registration. So it is compulsory to submit for principal investigator and principal investigator site, and at least one sub-I for site without PI or PI site. And this form is basically a pre-filled form in the system, so you can just download the form and then go and get your signature from your HOD and also your director of the facility. Basically, the signature is required from the place where investigator works, okay, not from the study site. So if you, for example, from Hospital Shah Alam, then the signature should come from Hospital Shah Alam, even though you are conducting a research in Hospital Klang, for example, in HSTAR. Okay. So these are the example of the form. So we have 3 columns whereby you need to have your signature in place. So basically, the differences between the IHDIA form and another type of approval to conduct of research, the site approval form. The site approval form is the one that you will send the form to the site that usually do not have any representative in the study team. Okay, that's the first one. The second one, it should be sent after you have obtained your MRC approval. Okay, as compared to IHDI form, that form should be submitted earlier in the beginning, during your research registration. So as you can see, based from our workflow, so IHDI form is the form that you need to submit during your research registration, whereby the site approval form is the one that you submit to the site that doesn't have any representative in the study team. Okay. So I will give you a scenario, okay, to make you more understand the differences between the IHDIA form versus the site approval form. So basically, for example, we have three sites: Site A, Site B, and Site C, whereby Site A we have corresponding PI and 2 sub-I. Site B we have Dr. X as a PI at site, and Site C we have Mr. Y and sub-I. So in this case, this usually I will ask during the course, NMR course. So who should submit the IHDIA form? So please remember the IHDIA form is a form one for all, one that is a representative form for the study team at one particular site. So for example, in this case, the one who is required to submit the IHDIA form is the corresponding PI from site A, Dr. X from site B, and Mr. Y from site C. All right. So in the second situation, whereby we have 2 sub-I, okay, please remember again that the IHDIA form is mandatory for PI and PI at site, and at least 1 sub-I, okay, for a site that doesn't have PI or PI at site. So in this case, the one who should send the IHDIA form for site B is either Mr. Z or Mr. H. Okay, either one is okay. All right, and for site A, corresponding PI will represent the entire team from that site. Okay, and from site C, PI at site, Mr. Y will send or will upload the IHDIA form. Okay, so for scenario 3, so we have 1 PI and the rest is sub-I. So basically in this situation, so for site B, okay, either one of the investigator is required to submit the IHDIA form, while site B, D and C, because there is only 1 investigator, so Dr. J and Dr. K are the one who will submit the IHDIA. Scenario number 4 is the most common one, okay, whereby we have a situation of Dr. A who works in site A, okay, and he or she will go to site B, C, and D to collect the data or to do the recruitment. So basically in this case, okay, you don't have any representative from other side, but you from site A, you will go and enter site B, C, and D for your research. So who should submit the IHDIA form? Dr. A, and that form should come from site A. So how about site B, C, and D? So this is where when you will send the site approval form. Okay, so after you get the ethical approval, after Dr. A obtain the ethical approval from MRC, so he will bring the ethical approval together with a form, or site approval form, to approach site B, C, and D, okay, for the approval from the director. The same goes to scenario number 5, whereby Dr. A is from establishment IHDIA form from site E, and for site A, B, C, and D, so Dr. A will send the site approval form. Right? So this is a case whereby, for example, from the hospital, from the university hospital, from the private facilities, and so on. So there are some misconceptions I would like to clarify with all of you. So basically, NMR is just a system that you use, okay, to get or to obtain whatever requirement that is already highlighted just now. Basically, for example, registration, ethical approval, MRG application, and for publication. So usually people will always say NMRR are the one who will issue the ethical approval, but basically it is not. The one who issue or responsible with ethical approval is MRC MOH. Each level processing, as you can see in our process flow just now, have different secretariat who oversee and involved in different level of processing. Misconception number 2 is related to NMR ID, whereby some would say NMR registration is just the same as the ethical approval. Basically, it is not. NMR ID is just the proof that you have registered your research, okay, whereby ethical approval have its own letter reference number, okay. And this is for those who are on study leave, okay. So let's say you are working in MOH and then you apply for HLP, okay, and then you go and you want to perform your research. So basically, for students affiliated with MOH who are on study leave, the requirement is you still need to register your research, okay, even though it is done in the university. Okay, why this is required? Because we refer back to the circular by our DG, okay, circular directive by our DG bilangan 4 2022. Okay, it says semua penyelidikan yang dijalankan oleh waran KKM hendaklah didaftarkan dengan NMR sebelum penyelidikan dijalankan. Okay, so if you even though you don't involve any MOH data, patient or sample, you still required to register your research, okay, during your master program or postgrad program ataupun post basic dan sebagainya. Number 4, the misconception is related to the ethical approval. All research require ethical approval. Basically, it is not. Only research involves human subject who requires ethical approval. However, okay, there are certain type of research, even though it is involving human subject, but it can be exempted. Okay, by principle, it is acceptable that it can be exempted from the ethical review. So, if let's say that particular type of research can be exempted, meaning that it is okay for you to just register without the submission to MRC. So what are the type of research that can be exempted from MRC review? So basically, these are the type of research that can be exempted. So we have a clinical audit, we have a case report, we have the QA/QC that doesn't involve intervention, systematic review. Okay, we have research involving non-human subject, research use publicly available data, okay, and so on and so forth. So if you are conducting, if you are planning to conduct research, for example, you want to report a case study, okay, so it is a requirement for you to just register. It is okay for you not to apply for ethical approval, okay. All right. The last confusion ataupun misconception is related to whether you should apply for MRC ethical approval or not if you are a student. So basically, ethical approval from university is required in order for you to fulfill the requirement and if the research is conducted at the university. However, both ethical approval is required, okay, university and MOH, if you are planning to conduct the research in both sites, and also it's a requirement for you to fulfill your study requirement, okay. So basically, that is already covered, as I said, 70% of the research cycle. So if you are done with your data collection dan sebagainya, okay, so what we should do with the data that you collected? Okay, so basically, it is always encouraged for investigator for the data after it is collected, cleaned and analyzed. Okay, so traditionally, it will be stored for a certain period of time and also it will be destroyed. But okay, in order for us to generate and contribute more to the knowledge, basically because our data is a human data. Okay, so basically when we try to combine, so it will make the data set become bigger. So in order to do that, so you can place ataupun you can deposit your data secara systematic in a centrally stored ataupun a repository whereby it can be preserved and curated, okay, and you can use it lah in the future sama ada yourself ataupun another group of people, okay, whereby for example is the research related to that particular interest and they can apply to you, okay, and use your data to add on to the whatever data that they will collect. So basically in ministry, we do set up our own repository system. Okay, it is called NIH DAS. It is operated under the Sector for Biostat and Data Repository in NIH. So basically, these are the repository of data whereby you can deposit any type of data that you collected. Okay, sama ada verbatim, okay, raw data, analyzed data, dan sebagainya. Even video pun you can store and deposit inside the repository system. Okay, so basically to extend, okay, the flow chart that I showed just now. Okay, so after in the data analysis and reporting stage, okay, before you even, like for example, you already done with all the analysis dan sebagainya, you just need to come up with your final report. You can start to plan to deposit your data in our repository system. Okay, so it is an extension to whatever flow that we have just now. Okay, so this stage already covered the other two stages of the research cycle basically. So the reuse of the data, so it can be reused later in the future, and for the long-term data preservation. Okay, all right, next. Okay, so we already have a storage or a depository for our raw data, for our research data. So what we do with our publication data, our finding, it is very useful for others and for investigators for you to plan also related to the preservation of your data finding, because probably in the next 10 years, okay, that finding can be something of very huge important milestone, for example. All right, so in terms of the publication and scholar works, so basically preservation of scholar works is essential to ensure the long-term accessibility, integrity, and the impact of the academic research, as I said. In Ministry of Health, we have a guideline which was released last year. Okay, Dasar dan Garis Panduan Nombor Pengelasan dan Penyerahan Terbitan Kementerian Kesihatan Malaysia, whereby this policy outlined the procedure for preservation of MOH intellectual properties, including the research output. So basically, in general, this policy highlighted three things. Okay, the first one is the open access and intellectual property management. The second one is the digitalization of the finding. And the second one is the classification and repository management. Okay, so the key point of this policy is basically all of the effort and also the responsible parties that involved in the preservation of the scholars' works is under NIH as well. Okay, to centralize the effort and also the procedure for the MOH. The same goes to digitalization procedure, whereby we have two systems that is related to the preservation of scholar works. So the first one is the MOHI depository system. So it is a centralized platform whereby you can submit for the number terbitan lah, basically the ISBN number, the KKM number dan sebagainya. So these are the system that you will use. Okay, for example, for any type of publication, poster, okay, technical report, buku, journal, okay, journal, your journal dan sebagainya, by right, okay, you should get the classification numbers lah, okay, from MOH, whereby it is catered by from our NIH library. Okay, and the second system that is set up to preserve the publication or the scholar works is NIH DSpace. Okay, NIH DSpace is a research digital repository system whereby it is dedicated to manage the Ministry of Health and the institution related research material. So basically, the objective is to provide the hub, okay, for institution within the ministry to collect, to protect, and to distribute its scientific and intellectual contribution, ensuring the visibility and long-term preservation. Okay, this was launched back in May, okay, and is still new. And at the moment, for deposition of any scholar works, okay, it should be done but from the CRC unit, if I'm not mistaken. Okay, like for NIH does, as individual investigator, you can deposit your data, you can go there and you can register and deposit. But for NIH DSpace, at the moment, it is not open for all. Okay, so if you want to deposit any type of scholar works into the system, you need to do it via the nearest CRC. Okay, and for referring to the research cycle, basically it will covers the other long-term data and scholar preservation and also the distribution part of the research cycle. Okay, so the extension is after, okay, you have gotten your approval, so you can plan to deposit all or any of your scholar works into the NIHD space, ataupun you can get the classification numbering from the MOH depository. Okay. So a bit on open science. So basically, we are currently trying to go towards an open science whereby it encourages investigators to share, to make whatever data and also your finding accessible, okay, reusable, right? And approaching to my end or the end of my presentation. So basically, my take-home message is, as an investigator, you need to adhere to the standard that is set up by the ministry to ensure that the research conducted under the ministry is ethically sound, okay, and it's protecting the participant right and upholding the integrity of the research process. And also, it is very important also for you, for example, to deposit your data, deposit your scholar works in order to enhance the presented is very essential to make sure that your research go up to the end and it will bring the benefits to the committee, to the community, and to the nation in general. All right. So these are the complete conduct of research involving Ministry of Health. Okay, from the beginning up until the end. Okay, following the system, the one who will cater, who currently catering the research conduct in the ministry. We have NMR system, we have NIH DAS system, and we have NIH digital repository system and bit on the ecosystem. So basically, these are the platform that we have in the ministry that will support the people and the governance of our health research in general. With that, thank you very much for your attention, and I open the floor for any research, for any question. Thank you.
Okay, thank you, Dr. Asyraf, for the good sharing. Okay, so now we open for the Q&A session. Okay. Dr. Asyraf, Doktor boleh tengok chat box tak? I think ada few question lah yang ditanyakan oleh Nur Farhana.
Yes. Okay, all right. To share slide. Okay, I mean, yeah, I will give the slide to the organizer and it can be shared to others as well. And try to share it as to all your colleagues and friends, that especially the one who really interested in conducting the research.
Okay, Doktor.
Saya PG Pak. Okay, ni daripada Farhana Farah. PG part-timer LKM staff, research self-sponsored. Okay. Alright. Tak dapat continue, clearnya tidak perlu. Okay, apa yang perlu letak? Okay, that's the first question. The second question is wajib submit abstract untuk conference. Alright. Okay. Basically, for the first question, if you have a self-sponsored study, so in the sponsor establishment section, which establishment that you should choose is you should choose the Ministry of Health ataupun your PTJ. Kenapa you should choose your Ministry of Health or PTJ as your sponsor establishment? Because dalam self-sponsor, so you are using your own money, and your own money comes from your gaji. So your gaji is from MOH, so that's why you just put MOH as the sponsor establishment. Okay, so that is the first question. The second one is related to wajib submit. By right, yes, you need to submit for approval before you submit for any publication or presentation, walaupun dia is a research thesis. Why? Because we referred back to the policy number 7. Okay. You need to apply for approval from the DG for research, okay, involving Ministry of Health personnel, conducted by MOH personnel, ataupun conducted using MOH patient data sample as a subject, or your study has been using MRG for the fund. So still, you need to submit by right. It is not really a law atau we not mandated you to do that, but we always encourage you to get the approval from the DG because you just need to submit your abstract and the form. At the moment, I'm sorry, I forgot to inform you, NMR haven't released the module for publication and presentation yet. Okay, soon enough, we will release that, whereby starting from the beginning up until the publication, you can submit that all through the system. So for submission of approval by the DG, you are required to submit it manually via email to the publication and presentation secretariat. Okay, I hope it answered to your question. Okay, alright. Ada lagi tak soalan yang saya perlu atau boleh jawab?
Bawah sikit, ada bawah-bawah tu yang
bawah grant, okay. Api-api. Okay, for grant, basically we do cover everything related to your research conduct and expenses. Okay, and we do not have a ceiling limit. Sorry, we do not have a ceiling limit. You can apply any amount that you like, but I would like to say that for application of grant, basically you need to make sure that your submission is in line with the research priority that we have. So I would advise you to go and refer and read our health research priority document. Okay, so kalau you tak minta grant, the higher the chances of you getting grant if you can fulfill or follow whatever priority yang ada dalam our health research priority. Okay, because dalam that document, for example, it will be color coded, whereby the priority has been set up following area of research. So if your research ada kena-mengena in that area, and that area, for example, happen to be the most priority punya attention given, okay, for the RMB 12, and definitely the chances of you getting the MRG is very high. But doesn't mean that if tak ada dalam tu tak boleh apply, you can still apply dulu sekarang ataupun tidak. Okay. Alright. Okay, mungkin yang ni last tu yang Mama Asyraf tu.
Okay.
Alright. As the university only require ethical approval of the registration for the courses. What do you mean by that? Mama Asyraf, mungkin you boleh explain a bit. What does it mean by only require ethical approval obtained from the institution for the course? Which course are you talking about?
If the study is conducted in university abroad.
Oh, okay, sorry, okay. If the university conducted abroad, using data from abroad, we need to go to register. Okay. The requirement for registration and approval is two different things. Basically, if your study happen to be, tak kisahlah abroad ke, local ke, but it doesn't use any MOH data, the requirement is for you to just register your study. Tak perlu dapatkan ethical approval. Ethical approval hanya diperlukan if your study involve human subject from MOH. Patient MOH, data MOH, sample MOH, anything related to MOH, the population that you want to study. So in this case, for example, if you are from overseas and then you are using overseas data, the requirement is for you to just register your study sahaja tanpa perlukan dapat MRC approval. Alright, tadi ada saya terlepas satu soalan ke atas to site approval not approved for the after MRC approval, what should the researcher do? Does he need to write back to MRC for the study closure? So basically, if in that case, there are a few things that you can do. The first one, you can change the site. Okay, so if you want to add or withdraw the site, you can do the amendment. Okay, and also yes, you can do the site closure, but usually site closure, we are not really doing it if you are conducting an IIR. It is always done by ISR, but for investigator research, just sama ada. For example, kalau kata you dah tukar site, the sample size can be different. So that's why it's up to you how you want to do that. But basically, you just need to amend your protocol lah, and then you can close the study at the end of the study conduct. Alright, is there anything else that I miss?
Okay, tak ada doktor. Tapi ada juga Jazila Idris. Berapa lama approval boleh diperoleh selepas complete dokumen dihantar?
Okay, so for the timeline of approval, good question, Jazila. So basically, it's very important for you to plan your timeline, kan? Basically, bila nak start. Okay, and then in the timeline also you need to plan for when you should send your study to sama ada untuk registration and also ethical approval, and how long it will require. So basically, untuk MRC secara ringkasnya apa yang saya boleh bagi tahu is, for ethical approval, okay, your study will be certified into several risks. Kita ada low risk, medium risk, high risk. So depending on the risk, your study will be reviewed differently. Sama ada experimental review ataupun full board review. So, secara generalnya, registration of research akan ambil masa 10 hari bekerja if your submission is complete. Okay, and then once it is registered, it will be forwarded to MRC. So basically, MRC akan buat 2 stage. The first is the screening stage. The second one is the review stage for minimal risk study. Okay, so basically, in MRC SOP, minimal risk study will take around 30 to 60 days at least, working days. And the higher the risk, the longer it will take usually. So from the registration up until the ethical approval, for example, for the minimal risk study, usually it will take around 40 to 70 days lah. But then depends on your submission as well. If you are able to submit a very complete protocol and also document and also information, basically you can get fast. Tak ada masalah. The problem with most of the submission is you cannot provide the information that is required in the protocol. So basically you will need to have a few revision done first before you will be approved. So my advice on that is try to go and have a look at the requirement by MRC. So where you can find that, basically you can go to NMR website, pergi kepada bahagian dokumen, pergi kepada bahagian template and form. Okay, there available document that you even can use as during the submission, basically the protocol, the PIS dan sebagainya. Okay, the same goes to submission during registration. What the things that you need to insert, we also have the document ready for you to assist. Basically, you can go to user manual part and try to have a look at data and parameter for NMR submission, whereby we do explain in detail every parameter required, what are the things that you need to insert during the submission. Okay, try to use that because it can be very helpful. And also, whenever you have a template ataupun a pre-fill form, for example, COI form is a pre-fill form in the system. IAHDIA form is a pre-fill form in the system. So try to use that because it can prevent for misinformation lah. Nanti you tak masukkan information dan sebagainya. So try to use the template that is provided and also the pre-fill form. That is my advice lah on that. If the sample from community not involve MOH, okay, and it depends. You are doing that during the work, during your time as MOH personnel, ataupun you are doing that during your study in university. Let's say the first situation, you are an MOH personnel, even though your sample is not MOH punya sample, it is a community, still the requirement, okay, for research involving human subject, you need to have ethical approval. Tak kisahlah daripada mana pun. So in this case, because you are MOH personnel, you need to have ethical approval from MOH. Okay, tapi kalau kata you daripada university, okay, so you can go and have the approval from the university. Okay, let's say you are just part of the study team, okay, a collaboration effort between MOH and also the university, for example. So in that case, if you are not the PI, you are just a sub-I, okay, and that study will involve community people and people outside public. So the requirement for the ethical approval falls onto the PI. tengok PI tu siapa. PI daripada universiti, dan dapatkan ethical approval daripada universiti. So in that case, you just need to register saja your study. Okay, so that are some of the situation lah yang might happen juga.
Okay, Dr. Thank you Dr. Asyraf for the Q&A session. Saya rasa berakhirlah sesi CM kita pada petang ini. Okay, sekejap ya.
Okay, and I would also like to thank again CRC Salam for the invitation, and I hope with whatever I have shared, it will be very beneficial for you. And thanks again, and hope to see you in the future. And good luck in your future research endeavors lah.
Okay,
Alright,
thank you Dr.
thank you
Ashraf.
everyone.
Okay, to all the participant, kalau ada apa-apa soalan lagi boleh email ke CRC lah, seperti yang tertera di screen, dan kami akan forwardkan kepada Dr. Ashraf lah kemudian hari, sebab kita pun kesetukan masa juga. Okay, and again thank you to Dr. Ashraf for joining us for today. Okay, and lastly, here is the QR code for the attendance to all the participants. Okay, and kepada semua participant, kalau dah siap the attendance link, you guys can leave this room lah. And thank you semua. Assalamualaikum.
Thank you, Dr. Asyraf.
Sama-sama Ashraf.
deserve it.